So I'm going to be talking about how we can identify these smoldering multiple myeloma patients who are more multiple myeloma-like. Different studies and different trials have tried to find high-risk features in these patients in order to identify who would have the highest risk of progression. After looking at all different studies, there were some common factors that have been associated with patients having a 50% risk of progression at the 2-year mark. Some of these criteria are a monoclonal protein in the serum of more than 30 or 3, an IgA subtype of smoldering multiple myeloma, immunoparesis, which is described here as the reduction in your IgGs, IgMs, or IgAs, either two of all of them. If you have a free light chain ratio involving the involved and uninvolved light chains of more than 8 or equal to 8, but less than 100, you're at a high risk as well. If you have a progressive increase in your M protein level, which is sometimes called evolving type of smoldering multiple myeloma, wherein your serum M protein is increasing by 25% on 2 successive staging workups performed within a 6-month period. If you get a bone marrow biopsy and you're found to have 50 to 60% plasma cells, if you have an abnormal bone marrow plasma cell immunophenotype, and reduction of the uninvolved immunoglobulin isotypes. If you have some translocations such as 414, if you have deletion 17p or 1q gain on your FISH studies, if you have plasma cells which are circulating in your peripheral blood, if you have an MRI with diffuse abnormalities or one focal lesion, if you have a PET scan with increased uptake but no osteolytic lesion, which is the hole in bone appearance we call for myeloma patients. I'm going to be talking about this 2-20-20 model, which is widely used and recommended by IMWG for finding out who the high-risk smoldering myeloma patients is. While this model is not perfect, it is easy to calculate because it only requires 3 parameters, which are a serum M spike of more than 2, a free light chain ratio more than 20, and a plasma cell percentage in the bone marrow of 20% as well. As per a study done by Lakshman et al., which was published in Blood Cancer Journal in 2020, 3 cohorts of patients were found using these criteria. Low-risk patients who have 0 of these high-risk criteria, intermediate risk patients who have 1 of these criteria, and high risk patients who have 2 or 3 of these criteria. Based on these groups, we found that high risk patients had about a 46% progression at 2 years into multiple myeloma.